Well, good morning, everybody. Hawkins here on the Maui Sunrise Show. Joining me on the air right now is a guest that we've had on before. We found him interesting and very helpful, and that's the important thing. His name, Dr. Randall Juleff, and he leads the Vein Clinics of Hawaii. 2 decades of experience here with Dr. Juleff, treating hundreds of patients with venous disorders, as well as a range of vascular, thoracic, cardiac disease. Dr. Juleff is a triple board certified in phlebology. I hope I pronounced that correctly. These are some big words for a DJ doctor.
You're doing good so far, Joe.
So far, we got it. All righty. And he is dedicated to patient satisfaction. Okay, Dr. Juleff focuses on precise patient evaluations accompanied by skillful treatment and compassionate care. Whoo, boy,
that's a mouthful.
I'll tell you. Did you know you were all those things?
I didn't. I'm going to have to read that over again and make sure we're living up to that.
Well, the important thing is you've got a lot of experience in the field that we're going to talk about.
Yeah,
and it's and that's what's so important in this, because this is and basically what it comes down to is folks that are experiencing pain in their legs, numbness, soreness. They just don't have the get up and go in their legs like they used to. There could be a serious, not always, but could be a serious underlying problem, and that's where you come in.
Yeah,
not necessarily to say, yeah, you got a real problem here, but also on the other side say, okay, we can fix this. You know, this is a simple thing, and you don't have to live with this pain any longer.
Right. Yeah, well, we're talking about something called venous insufficiency. And that just means that the veins in the legs aren't working the way they should. Mm-hmm. And yeah, you know, what you're getting at is absolutely right. The symptoms of venous insufficiency come on very slowly and over a fairly long period of time, over a matter of years. People are slowly developing this problem. So it's pretty easy for people to just kind of get used to it, ignore the symptoms. All the time we hear people coming in and they're kind of chalking their symptoms up to aging. You know, everybody says, well, yeah, you know, my legs are tired, but, you know, I'm getting older, that kind of thing. And that's not necessarily true.
Yeah.
You know, the symptoms that you might be having in your legs may very well be due to a medical reason. And it's, as you also alluded to, it's a fairly easy job to figure out what's going on. Number one. Number two, the new technology that we have these days makes treating it very, very easy as opposed to what we used to do.
Sure, easy for you to figure out what's going on.
Yeah, well, that's what we do.
Put that in my hands. That's what Dr. Juleff does. Okay, so basically what I would know, or what I guess the common person would know of this, is varicose veins.
Yes.
Most recognizable problem. Those big, ropey blue veins you see, and you see them primarily in women. And you brought up an interesting point, I think, last time. It's because women wear shorts more.
Yeah.
Women, you know, you're bound to see, or dresses, you're bound to see, but it's not just a female problem.
No, it is not. And that's another one of the misconceptions of vein disease in general, is that it is, you know, it just occurs in ladies. But I know from our experience, or my experience over the last 20 years, we are right now currently seeing probably almost as many men as women. Now there is, from a genetic standpoint, and also from a women get pregnant, that can be very hard on veins. Women have hormonal changes that occur over the course of their life that can kind of lead to or make it a little more risky for them to develop vein disease. But men are not very far behind. And really, in most of our offices, it is very close to 50-50 for sure.
Wow. I'm like, I think most people think of it as being a woman's
Absolutely.
disease, but you're 50-50. Okay. So what is it diet related? What causes the varicose veins? How do you get to that place?
Well, the main risk factor, when we're talking about a disease process, we always talk about, what are the risks risks of developing that disease. But the main risk factor for venous insufficiency and venous disease is genetics. Mm-hmm. So if
mom had it,
if mom had it, if grandfather had it, or whatever, then your likelihood of having it is higher than for those other than or related to those people who don't have those genetics. So to give you an idea, if you have one parent that has venous disease, that the children of that pair of parents, one of which has vein problems, the chances of them developing vein problems is about 60%.
Oh.
So it's pretty good. Yeah. Now, if you have both parents that have vein disease, it's about 90%. So, both your parents have, varicose veins and vein issues, and it's almost a predestined conclusion that you will probably, likely have that. Now, why is that important? Well, that's important because of the fact that, and you kind of brought it up before, the most recognizable thing that indicates to people that they have vein disease is varicose veins. So, somebody has varicose veins, they say, gee, I have a vein problem. That's pretty easy.
That's an easy one.
Yeah, that's an easy one. Now, unfortunately, or fortunately, but there are a huge number of other symptoms related to venous insufficiency that the normal layperson is not going to necessarily connect with, varicose veins / venous insufficiency. So I think for people out there, if they are, if they're listening to this and they're saying, gee, yeah, I remember, mom had a bunch of varicose veins, maybe even had vein stripping, 30 years ago or whatever. They may not have varicose veins, but they might be having some of the other symptoms of venous insufficiency, and that might give them a reason to consider having it looked into.
You brought up a point here that what you do today is not how it was treated 30 years ago.
Right.
Because from what I remember, listening to my mom, grandmothers and that, it was rather painful.
Oh, yeah.
But that's not the case anymore.
No.
Is it? I mean, you have new treatment options and modes of different sort of treatments and therapy.
And that's another one of the hurdles that we are always struggling to get over, because people remember that.
Yeah.
They remember either mom or grandma or granddad or whatever, and they had a bunch of varicose veins, and they went into the hospital, and they were there for several days, and they had a big operation. Back in the days of what we would refer to as surgical vein stripping, and I remember those days. Mm-hmm. People were admitted to the hospital. We did it in the operating room. They had a general anesthetic, which has a certain amount of risk to it, just in and of itself.
That's when you're laying them out completely.
Yeah. And a bunch of incisions all over your legs, and it was pretty gruesome. A lot of bruising, and it took a while to get over. So those procedures have been replaced by procedures that we do totally in the office these days. People are awake. They may take a little Valium or Ativan just to relax a little bit. We don't make any incisions anymore. Everything is done through just little needle puncture sites. They come into the office and have a procedure that might, last 30 or 45 minutes, and then they leave and go on with their day.
They walk out.
Yeah, they walk out.
Wow.
And basically, very few restrictions. They can, many people go back to work, or many people will come in the afternoon, have a procedure, and then the next morning they go back to work.
Well, I've heard your commercials. I just want to come in for that back rub that your nurse gives. I'd come in for that alone, but that's terrific. So people don't have to worry about the way it used to be.
Right.
You can say that about everything in medicine today. They don't even have to crack your chest anymore.
Yeah.
And for heart surgery, and they certainly don't have to cut your legs to deal. I'm sure there are times when it's more serious that you may have to take a different approach, but for your average person coming into the office, they come in, like you say, 30, 40 minutes, and they can walk out fairly pain-free.
Mm-hmm.
All right. So, at what age and at what point should somebody come see you if they have a concern?
Well,
is there an age involved?
Well, no, there really isn't an age because it's kind of a equal age opportunity employer. I think the youngest patient we ever treated was 15.
Really?
And that was a young boy, actually.
Varicose veins.
A lot of big varicose veins. Now he had a very, very strong family history, and he was active, healthy, but he had these huge varicose veins, and he was getting teased, at school. So we treated him, of course. We have treated up until the age of 95. Actually, really? Just a few months ago, we had a patient on Oahu that was 95. Now, granted, he was in good health for 95, very active and all that. But so age is not age in and of itself is not a contraindication. But I would say to answer your question again, if somebody has concerns or complaints or symptoms that they may or may not understand related to their legs, they should come in and see us because we'll be able to figure out whether it is a vascular problem or not. We treat vein disease. That's what we do. But I used to be a heart surgeon. I did vascular surgery. So if it's an arterial problem, we can figure out what it is and what needs to be done and get that patient to somebody who would treat those types of things. Or if it's something else. I mean, we can sometimes people have symptoms and we don't immediately know what it is. So sometimes we're kind of left with, well, let's rule this out. Let's rule that out. So again, we can rule out or rule in, a vascular cause for their symptoms. But, some of the symptoms that people don't necessarily connect with vein problems are just achiness of the legs that kind of progresses throughout the day, especially if in people who work on their feet.
Sure.
All day long, they have a higher risk of developing vein disease. And over the course of the day, their symptoms will increase. But achiness, heaviness, and fatigue are probably the three most common and consistent symptoms that have to do with venous insufficiency. But muscle cramping, something that we call restless leg syndrome, numbness, tingling, all of these symptoms might be related to poor vein function.
Sure. So somebody that is experiencing
anything
that you talked about or even has a suspicion, don't wait. Because we end up worrying ourselves to death sometimes over things that aren't there.
Yeah.
It's just as important to find out what you don't have as it is to what you do have.
Well, that's absolutely true.
I mean, it's both sides of the coin there. So somebody decides it's time to go see Dr. Juleff.
Yeah.
You have offices in Wailuku on North Market Street.
Mm-hmm.
Is that correct?
That's
but
true.
You're also available to Outer Island patients as well. Please.
Well, we have an office in Honolulu, near the Ala Moana Shopping Center, just behind that.
Very central.
Yeah, centrally located. We have an office in Lihue.
Okay.
We have the Wailuku office here in Maui. We have two offices on the Big Island, one in Hilo and one in Waimea. And I think that covers it. Yeah, we have 5 different offices.
Plenty of offices centrally located on each of the major islands. Folks, if you're experiencing anything that Dr. Juleff spoke of this morning with the pain in your legs, if you already see the varicose veins, the spider veins, the tiredness, the soreness, the swelling, all these things, time to come down, get it checked out.
Yeah.
You take insurance.
Yes, we do.
Absolutely.
And all of these things that we've talked about today are considered a medical problem. Sure. They're not a cosmetic problem, which is another misunderstanding of many people.
Yeah, we could talk about that. We'll save that for another time. But
But anything that is considered medically necessary is covered by Medicare and insurance programs.
I'm going to give them your web address because that's a wealth of information and phone numbers are there and it's easy to access and everything. So it's Vein Clinics, plural on the clinic, right? VeinClinicsOfHawaii.com. Got it? VeinClinicsOfHawaii.com, 140 North Market Street in Wailuku. I'll give you their local number here on Maui. You folks on the other islands can find the phone numbers on the website, VeinClinicsOfHawaii.com. The phone number here in Wailuku for Dr. Juleff is 808, of course, 214-5715. Dr. Juleff, thank you for coming
Joe.
down. I know you're a busy guy. You got to go look at all those legs.
Yeah.
And, it could be worse. You know?
Absolutely, it could be worse. Absolutely.
So we appreciate what you do for us here on Maui.
No, thank you,
take
Joe.
good care of our
Appreciate
patients
it.
and our listeners, and we'll have you back again. How's that?
Sounds good.
All righty. Dr. Randall Juleff at Veins Clinics of Hawaii. Folks, if you're experiencing any of that stuff, please go see the doctor, okay? You'll be glad you did.